Hi, my name is Dr. Doug Pooley, and welcome to the fourth in our segment of information series that we're going to do to present to you some strategies to hopefully protect you and your family from this horrible COVID-19 that we find ourselves in the middle of. Today I want to talk to you a little bit about functional breathing, and this may be the most important information that I give you so far, because as everyone here knows, this horrible disease essentially is one of the respiratory system. I mean, that's where it does the most damage. So if we can find a strategy to improve lung function as well as improve immunity in the process, it's going to go a long way towards helping to hopefully allow us to fight this thing off a little better. The lungs are fabulous, fabulous mechanisms. You may not know it, but you breathe 23,000 times a day. In that course of that 23,000 times, you inhale and exhale between 8,000 and 9,000 liters of air each and every day. If you were to take all of the little compartments within the lungs and add them all together, it would amount to 15,000 miles or 2,400 kilometers in length. The purpose of the lungs, of course, is to do one thing, and that's to bring air into the system, and with it, oxygen. And oxygen is perhaps the single most important component of life. You can live without food for 40 days. You can live without water for 3 days. But within a little bit more than 3 minutes without air, most of us are dead. Oxygen is a critical component of every single physiological function in the body. And it's funny because as we age and in periods of forced confinement like we find ourselves right now, we tend not to breathe as effectively or efficiently as we have or we would do in other circumstances. Even normally, the average person in North American society uses about 1/3 of their lungs, the top third, which means that they use about 10% of their vital capacity. And there's critical evidence in the science today that demonstrates a positive correlation between proper breathing function and proper immune function, proper circulatory function, even affecting your mood and your digestion. So what I'm going to show you today is a little bit of belly breathing. And the breathing techniques have been used, functional breathing techniques have been used in different traditional medicinal practices, probably from the beginning of time. So this is simple and it works. It's going to help to build your immune function, but most importantly, maximize your lung function. So what I want you to do is to sit in a chair with your legs comfortably parted just like this. I want you to be about 4 inches from the back of the chair. So what we're going to do is we're going to do a breathing process where you're going to take air in to a count of 7, you're going to hold it for a count of 5, and you're going to exhale for a count of 10. If you've got tight-fitting clothes, tend to loosen it a little bit. So here's what it's going to look like. Try to get your arms up as best as you can, just to help to facilitate a little bit more inspiration. So you're going to first start by blowing out. You're going to breathe in for 7, hold it for 5, breathe out for 10. Then you're going to take a little bit of about a 20-second break, because for some of you people, you may get a little lightheaded in the process. I want you to do 3 to 5 reps, and at the end of that, I want you to sit comfortably for at least a minute just to make sure that you're not dizzy or lightheaded. Do this 3 times a day, and I guarantee you it'll do 2 things. It'll improve your energy, and it'll also help to improve your lung function. So hang around. We're going to talk the next time. We're going to talk about the importance of detoxification. Again, in helping to stimulate immune function, make our bodies work a little more efficiently to help us fight off this COVID-19. Thanks, guys, for watching. And if you like what we do us a favor, share it around. Thanks.